Tulsa dodges a bullet when it comes to Ebola. A Tulsa area man who had recently traveled to West Africa had a fever spike last night. It's a story that we first brought you as breaking news on 2 News at 10 last night. Well, today, 2 sets of tests show that that man does not have Ebola, but he's not out of the woods just yet. It's been a busy 24 hours for Tulsa healthcare workers. Late Thursday, a man who had been to West Africa, the epicenter for the Ebola crisis, had a fever spike.
The Tulsa Health Department has been monitoring an individual who recently returned from West Africa. Now that individual was determined by the CDC to be low risk.
But that fever was cause for alarm. The patient was taken by ambulance to the OSU Medical Center in downtown Tulsa and put in isolation. Word of a possible Ebola patient spread quickly, but this morning, a sigh of relief. 2 test results show no Ebola. A 3rd set of tests will be run this weekend.
As a precautionary measure, samples are still being sent to the CDC to be tested for Ebola, but that's really a precaution. This individual had no known exposure to the Ebola virus.
That's the good news. The bad news is that the patient tested positive for malaria. While malaria is treatable and far less insidious than Ebola, it's still serious. But as far as the public goes, the patient is not contagious.
It's important to remember that malaria is not something that's transmitted person to person, meaning that this individual is not going to give malaria to someone else. The only way to contract malaria is through the bite of an infected mosquito.
Now that patient remains in isolation at the OSU Medical Center back here behind me. He will remain in isolation until he gets the all clear from the CDC. That will likely happen this weekend, either Saturday or Sunday. Of course, we'll keep you posted on all that. He will then be monitored for his 21-day incubation period. All right, new at 5, the State Health Department announcing the creation of a high-level Ebola treatment facility here in Oklahoma. It'll be operated by the OU Medical Center and will be located in a decommissioned hospital building on the Oklahoma Health Center campus in Oklahoma City. That unit will be separate from existing patient care facilities. Construction is expected to take about 3 to 4 weeks to build. All right, meanwhile, local hospitals taking extra precautions to protect staff, patients, and visitors. Hospitals like Hillcrest and St. John are using questionnaires like the one you see here for anyone being admitted. The hospitals also have posted signs asking patients to speak up if they have Ebola-like symptoms. A $500 million lawsuit against the Kimberly-Clark Corporation. It alleges that the company falsely claimed that its surgical gowns protected against Ebola and other infectious diseases. In fact, the lawsuit alleges that the company knew for at least a year that its gowns had failed industry tests, but continued to claim that the product provided the highest level of protection against diseases, including Ebola. Kimberly-Clark has a paper plant down in Jinx, but they do not make surgical gowns at that facility.